All right, let's jump right in. Today, we're tackling a topic that seems so simple on the surface, but is actually incredibly complex: wound management. And believe me, it's about way more than just slapping on a bandage. The sheer scale of this might just surprise you.
So let's start with a number: 500,000. What is that? Well, on any given day in Australia, that's how many people are walking around with a wound that just won't heal. Just think about that for a second. That is a massive and often invisible public health issue. And with that human cost comes a huge financial one. We're talking $3 billion every single year. That's what this costs the Australian healthcare system. And that's not just the direct cost of treatment. That number also includes things like lost productivity from people being unable to work. It's a gigantic burden.
So this begs the question, right? We all get cuts and scrapes. How can something so common be so complicated and so expensive to manage? Well, the answer really boils down to two things: who's getting these wounds, and the amazing and sometimes frustrating science of how our bodies actually heal.
And here's the thing: this problem isn't getting smaller, it's actually growing. We're seeing these huge shifts in our population that make healing a lot harder. For starters, we have an aging population, which often means more fragile skin. Plus, we've got rising rates of things like diabetes and poor nutrition, which can seriously mess with the body's ability to repair itself.
So, how do doctors and nurses even begin to tackle this? Well, the first step, and honestly the most important one, isn't what you might think. It's not about grabbing a dressing, it's about being a detective. Modern wound care is all about a thorough investigation before taking any action. And what's really fascinating is that healing isn't just about the wound itself. Clinicians have to look at two big categories of clues. On one side, you've got what are called intrinsic factors. This is everything about the patient: their age, their immune system, what they eat. Then on the other side, you've got extrinsic factors. Everything about the wound's environment. Is there pressure on it? Is it getting infected? Both sides of this coin are equally critical. Now, to make sure nothing gets missed, there are systems for this, like the TIME framework. It's basically a methodical checklist. T is for tissue. What does the base of the wound look like? Is it healthy? I is for infection or inflammation. M is for moisture balance. Is it a swamp in there, or is it a desert? And E is for the edge of the wound. Are the sides actually closing in, or have they just given up? Every letter gives you a vital piece of the puzzle. Okay, so another really fundamental part of that initial detective work is figuring out which of the two main families a wound belongs to. Because, let's face it, not all wounds are created equal, and you're not going to treat a paper cut the same way you treat a wound that's been around for months.
And this is the key difference. On one side, you have acute wounds. Think of a burn or a cut. They happen, and then they heal pretty predictably. But on the other side, you have chronic wounds. These are the stubborn ones. They failed to heal, often for more than 6 weeks, because there's some underlying problem that's basically put the brakes on the whole healing process.
All right, so now that we've covered the assessment and the different types of wounds, let's talk about treatment. And this is where things have gotten really, really interesting. We've moved so far past the old idea of just covering a wound to keep the dirt out. Which leads to this question: are all these modern dressings just, glorified expensive bandages? And the answer is a resounding no. Not even close. They're actually highly sophisticated tools designed to be an active player in the healing game.
The best way to think about it is like this. You've got your old school passive dressings, like gauze. They're basically just a dust cover. They protect the wound, but that's about it. Then you have the new school interactive or bioactive dressings. I love this analogy. They're like a smart thermostat for the wound. They actively change the wound's environment, managing moisture, fighting bacteria, to create the absolute perfect conditions for the body to do its healing magic. So yeah, a modern dressing is a real multitasker. It's not just sitting there. It's actively working to protect, to absorb extra fluid, or even add moisture if the wound is too dry. It's providing an antimicrobial barrier and fine-tuning the whole environment so the body's own repair crew can get to work. And all of this, the detective work, the wound types, the smart dressings, it all leads us to the single most important principle in modern wound care. If you take one thing away from this, let it be this.
This is it. Great wound care is not about finding some magic dressing. It's about figuring out why the wound isn't healing in the first place and then treating that root cause. Take a venous leg ulcer, for example. The real problem is often bad circulation. You can put any dressing you want on it, but that ulcer will never, ever heal until you fix the blood flow problem, usually with compression therapy.
And I want to leave you with this fantastic quote from our source material from Jeffrey Sussman. A dressing manages the wound environment, not the cause. That just says it all, doesn't it? The dressing is a crucial tool, for sure, but the real healing, the real solution is always about treating the patient, not just the hole in the patient. Thanks for tuning in.